back with Dr. Davidhizar. Dr. Davidhizar, I'm not so sure whether back pain and sciatic pain is the same and one triggers the other one, but lots of people suffer from sciatic pain. Do you have any things you can tell us about it? Shed some light on it, where it comes from, why, and can it be helped?
Yes, well, sciatic pain, of course, comes from the nerve, the sciatic nerve, which comes out of your low back. It comes from the spinal column and radiates down into your leg. It's really all the nerves that go into your leg come from this nerve. So when you have a pain or a ruptured disc or something that's affecting the origin of the sciatic nerve in your spine, people get pain down that nerve into their leg, and they call it sciatica. And so that's common for a lot of people with ruptured discs or even just with inflammation of the sciatic nerve. So we talked earlier about, injections. Injections help that a lot. There's other treatments for it. We do a treatment called decompression. We actually just lay on this table. We look at what it does. It actually puts some force, slight, but at different angles. So it actually kind of pulls those vertebrae apart a little bit, just minutely. But it's enough to take the pressure off a disc if that's causing the problem, and lets it slide back in place. Your body wants to heal itself. If we give it a little bit of a chance, it will do that. So if we can take the pressure off that disc, it frequently goes back into place, and it's really the best treatment of all for that sort of thing. It doesn't require surgery, no injections, and it's worked well for many of my patients.
Wow, yeah, I heard about it. So, basically it works on, again, it makes sense because on a daily basis we stand and there is about 150, 200 pounds, pressing this whole body together, constantly, even when we sit, it may not be 200 pounds then because just the upper body, but the point is it presses it together. So what this machine does, it kind of pulls it apart a little bit and that kind of like relieves that constant pressure. Is that what it is?
True, yes.
Okay. And so that works for, you do that usually in conjunction with your injections which you give, which by the way, I don't know whether that's normal, but to me it isn't. Those injections are not painkiller injections, right?
Right, no.
Yeah.
Well, sometimes we do this treatment with injections, depending on how well the patient's doing. If after a few treatments, it takes quite a few treatments with that machine because it takes a long time to sort of gently move that apart. Most people get between 20 and 30 treatments. But if by 15 or 20 treatments we aren't getting the results that I think we should be getting, sometimes we'll then do injections along with it. And that's worked well for some people, the combination. Or sometimes we just continue it and eventually it gets better without more injections. But it's not uncommon to combine the two.
Okay, I can see that. Now, about this decompression machine, would it be, what do you think about those machines, I think they call them inversion kind of things, where people hang themselves from the feet and achieve some, would that be good as a follow-up home remedy after they have been cured by you?
Well, it's sort of the same principle, but the problem with the inversion machines or tables is that you get too much weight on it. We don't use that much weight when we do the decompression treatments. We take about a half of the patient's body weight. So I have some of my patients that have those inversion tables at home, and I tell them never to go completely upside down. First of all, we aren't made to be that way. Our circulation gets all messed up doing that, and you get too much high blood pressure in your head and neck. But if they go only about 45 degrees, that will help them some in combination with the treatment we do, as long as they don't get too much weight on it, because it can make it worse. I
see. Okay. Well, wonderful. Again, very informative. So now we know that sciatic pain basically originates in the lower back, and from there it comes, and it's more or less treated by treating the lower back pain. True. All right. Absolutely wonderful. I learned something again today, and I'm sure so did some of the viewers who are going to see these videos. So at least I hope. Bye-bye, Dr. Davidhizar. Bye.